So the NAACP, working under the banner of the Black Leadership Forum, with so many of our friends, our colleagues on so many important civil rights issues, are focusing on the issue of health care for all Americans. Very well making sure that as this health care reform initiative moves forward, that the real concerns of diverse communities like the African American communities and other communities of color are not forgotten. We realize as we move in this direction that one size does not fit all. So a program that has multifaceted has to be put in place. With that in mind, we're strong proponents of a very strong public option, meaning that we want to have some competition. They very well as private insurance do a decent job for some, they don't do it for all. And having the option that is run by the government to allow us to compete against those private insurance companies, but also move forward on initiatives that would allow greater access, affordability, and sustainability is extremely important to all of us. So with that in mind, the NAACP, working with our friends, are working to get information out to people so that they are well informed. We went through a horrendous month in August where misinformation was sent out and then distractions were created to actually shout down those that would help correct that information. We want to make sure in this democratic process that never happens again, that all Americans have the opportunity to apply their own free will, understand what's going on, and utilize that very sacred process we call the democratic process of the United States of America as our government moves forward to finally bring this historic change. So we're excited. We're looking forward to how things move, and we're convinced when it's all over and done, when the smoke clears, we will have advanced the issue of health care protection and affordability for all Americans, and millions more Americans will have the opportunity to get pre-care, to get care when their children are sick, and to eliminate the fear we now live with, the fear of losing our insurance, the fear of our co-payments increasing, the fear very well of finding ourselves having to, in too many cases, sell our homes and our livelihoods just because one of our family members became ill.